drive many through initiative like health education seminar like this one that we're doing today, community outreach, Ronald McDonald's House, Adopt a Highway, Youth and Education Scholarship, Back to School Program, seasonal support like turkey giveaway, winter coats. So it's my honor to introduce our guest speaker for today, Dr. Ruby Zucker. Dr. Ruby is a board-certified internal medicine physician specializing in adult care for patients 18 and older. She earned a medical degree from Rutgers Robert Wood Johnson Medical School in Piscataway, New Jersey, and went on to complete her internal medicine residency at Thomas Jefferson University Hospital in Philadelphia, Pennsylvania. Outside of medicine, Dr. Zucker loves baking, cooking, playing trivia and board games, and practicing embroidery. So, Dr. Zucker, the floor is yours. Thank you for coming.
Thank you so much for having me, and thank you everyone for joining on a Saturday. Preventative care. So I'm Ruby Zucker. I'm an internal medicine physician. I'll do a little more of my intro on the next slide, but I just wanted to start by saying preventative medicine and preventative care is a huge topic that you could talk about for many hours. So I kind of just tried to distill down into a few key points and things that I think are relevant for people to know, that people might not know, just things to keep in the back of your mind. Of course, having a primary care doctor that you can go to regularly is also super important. So just a little bit about me, like was said. So I'm an internal medicine doctor. Usually when you have like a family doctor or a primary doctor, people call them internists, it's usually they're trained in family medicine or internal medicine. So family medicine, they tend to see more kids. Internal medicine, like me, I just see adults 18 and up. So I'm a relatively new doctor. I completed residency last year and then have been working. I work for Capital Health at their Mountain View office as a primary care physician. I don't have any disclosures except that I will push having a primary care doctor since I am one, but otherwise I'm just doing this because I care about it and I want people to be informed and learn things. So my kind of overall goals, I decided instead of focusing in on one specific thing to touch on sort of the big areas of preventative care, primary care. So I wanted to talk to you a little bit about like, what does that mean? What is that preventative care? I'm going to touch briefly on like food and exercise, what the recommendations are, and how that can help your health. I wanted to talk about screening, which we'll kind of define and talk more about, and then we'll talk a little bit about vaccines as well. So sometimes in medicine, we talk about this idea of different levels of prevention of things. So I put this picture of a river because there's a metaphor I like. I have an example here with cholesterol. If you're having a heart attack, we have things we can do in medicine. We can treat you and give you medicine and do stents. But for those of us in primary care, if you're at the point where you're having a heart attack in the hospital, you've kind of reached that waterfall. We're far down that river. And what our goal is to try to get people out of the river way far upriver, right? We want to remove people who are floating towards that waterfall, and we want to help them early on. So sometimes we divide care into the idea of primary, secondary, and tertiary care. So tertiary care is, like I said, you're having a heart attack, you go to the hospital, you get a stent. You have the condition. But if you go farther back upstream, primary care is you see your doctor, you get your cholesterol checked, you make sure it's okay, you eat a low cholesterol diet, you talk to your doctor about medication if it's needed, and you do things that can then prevent that from happening later. So it's preventative care, primary prevention. It all kind of means the same thing, but it's just trying to catch things earlier before they cause a serious problem to your health, things that can lead to permanent disability, death, really horrible outcomes that we want to avoid. So what I'm talking about is really those early steps to prevent things from happening down the road. So, of course, nothing about preventative medicine would be complete without talking about food and exercise. I think there's a lot of information. There's a lot of information on the internet. People read things, talk to people, do their own research. From actual, studies and evidence we have, exercise is one of the most important things you can do, both for your physical health, your mental health. It's actually one of the only things we really know can help prevent dementia later and memory loss. And it doesn't, I think a lot of people think it has to be, they have to go to the gym and do hours of workouts. It doesn't. Even 150 minutes a week, which averages to 20 minutes a day, can make a significant difference on your health. And if you're like, there's no way I can do 20 minutes every day, you can spread that 150 minutes over fewer days. Like you could do half an hour, 5 days a week, or 3 days of 50 minutes. Like you can do it in less days, and that still counts from all the studies they've done. But that goal of 150 minutes a week is what I recommend to my patients to aim for exercise. If you don't do any exercise now, doing some is better than nothing, and just with the goal of getting to 150 minutes. The other thing is you don't have to be a marathon runner. You don't have to be running at top speed the whole time for the 150 minutes. Walking absolutely counts and is incredible exercise. You should be out of breath. Like if you're doing walking for this exercise, your weekly exercise, you should not be able to have a full conversation. You should feel out of breath, definitely be working, but you don't have to be jogging. You don't have to be running. Just getting out there for a walk. People do, sometimes people walk around their house, or they have those little walking pads, or bike riding, swimming, all of that stuff counts. So just something, something is better than nothing. And the goal is at least 150 minutes a week. Obviously, you want to build up to it too. You don't ever want to go too intense and get hurt, because then that leads you down a whole path you don't want to go down. So I always say start slow and build up to it. And also stretching can help with that. There's tons of stuff that you can read about of all different stretches. Again, I always say start slow, but an important part of just making sure you don't get injured, but it doesn't count toward the 150 minutes. And exercising regularly, like I said, helps with memory loss later in life, helps decrease blood pressure, helps with your sugars, helps with your bone health. It has many, many benefits. And then I think hand in hand with that is, okay, you're exercising. Well, then what should you eat? Diet is obviously it's a very difficult thing, because there's a lot of factors, right? Like food costs money, it takes time to cook. People might not have time and money to do the food that they, ideally should be eating. It's a very complicated part of health. And, I think the thing that I tell my patients is, things should be, you should think everything in moderation. So I don't like to say never eat, XYZ, but just try to be conscious of things and maybe eat less of something. And I have another slide about something you can definitely limit, but there's a lot of supplements you can buy online. None of them are really shown to work at all. None of them have evidence to back them up. And honestly, most of them are just going to take your money and not do anything. The only real evidence we have for a quote unquote diet or way of eating that can be beneficial for the health is usually like a Mediterranean type diet, we call it. So it's like whole grains, not a lot of carbohydrates, so not a lot of sugar, processed food, potato chips, bread, pasta, like those things you want to limit. And a heavy emphasis on fruits and vegetables. So, vegetables have tons of fiber. They make you feel full without having a lot of calories in them. They have a lot of benefits. So heavy emphasis on fruits and vegetables, some whole grains, some good fats. So good fats are like nuts or olive oil, avocado, not a lot of red meat. Fish and chicken is usually what's most beneficial. Not too much salt. And, some dairy. Dairy is good. It has calcium, but, not like tons and tons. And then usually what I tell people too is depending on what's going on with your health, you might need to make, slight changes to this diet. Like if you have high blood pressure, you probably need to eat less salt. If you have diabetes or prediabetes, you're going to limit the carbohydrates and the sugar a little bit more. But generally, that way of eating, the Mediterranean diet, is what we recommend because that's the one we know really helps. There's tons of diets out there. Most of them, are not harmful. It's just we don't, they're all kind of, they may work, they may not. If you're trying to lose weight or you're trying to do, whatever you're trying to do, there are a lot of them. And then I also put on here, a lot of times we recommend the DASH diet, which is for high blood pressure. So there's a little picture there, but that one is sort of more specifically aimed to help decrease blood pressure if you're a person who has high blood pressure. Okay, I think I went over all that. And then a lot of times when someone comes to me and we check their sugars and they're kind of in that pre-diabetes range where their blood sugars are a little higher than we want them to be, my first question usually is, do you drink sugary drinks? It's not just soda. So soda, sweetened iced tea, juice, even juice that says no sugar added, it's essentially the same thing for your body as soda. What I tell my patients is when we take care of patients, in the hospital or someone who has dangerously low blood sugar, if they have, maybe they're on insulin and their blood sugar is dangerously low, and we want to raise their sugar as fast as possible, we give them juice. That's the treatment for it because juice just shoots your blood sugar up immediately. So I tell people any kind of juice, soda, lemonade, sweetened iced tea, coffee drinks that have, a lot of sugar added to them, those all, your body just absorbs that sugar so fast and it shoots your sugars up. So I usually say that's a good place to start with trying to decrease your carbohydrate intake because carbs, people usually think bread, but carbs are really all types of sugar. Bread turns into sugar in your body. Juice is just sugar as soon as you eat it. Drink it, I guess. So again, everything in moderation. I'm not saying you can never have juice again, but if you're someone who drinks, a big cup of juice every single day, and maybe your sugars are a little high or you're worried about it, maybe someone in your family has diabetes and you want to avoid it, I tell people maybe like start with half a cup and maybe it's just, on weekends you have juice, or just start to think about it and be conscious about it and cut it down. And what should you drink instead? Always water. Water is everything your body needs. I have a lot of people who tell me they don't like the taste of water or they don't want to drink water. Put a little bit of lemon in or put cucumbers in, or, they try to do what you can to be able to tolerate it, but water is the best thing for your kidneys and just for your overall health. If you're feeling thirsty, don't drink soda, don't drink, iced tea, drink water. So then the next, there's, like I said, there's a lot of different aspects to preventative care or primary care. Another part I wanted to talk about is screening. So screening, that term, we talk about a lot in primary care, and it's specifically like this picture, we're casting a broad net, looking at a lot of different people and doing testing to try to identify illnesses early on before they are a problem. And sometimes people, I think, are a little bit confused because, they may say, oh, I'm having, a bowel issue, I'm having diarrhea, but I'm not yet at the age where I need a colonoscopy. Well, that's different. That's what we call diagnosis. If you have symptoms or a problem, then we need to address that problem. And, if you're younger than 40, you might need a mammogram or something like that. But screening specifically is you have no symptoms, you feel fine, you're like, I don't have a problem, but we still want to test you because we want to try to identify those people who are, may go on to have more of an issue. And a lot of it is focused on cancer and trying to find cancers early on. So, screening is a huge part of what we do in primary care. For my patients, I usually will keep an eye on it at most visits, but if someone comes in with a rash, I'm not going to talk to them about their screening tests usually. I generally do that kind of at the annual exam, the annual physical, where they come in and they say, I'm feeling good, I'm just here to see my doctor and stay up to date. What do I need to do? And that's when I go through with each patient, their age, their risk factors, what's going on, and we figure out, okay, here's the list of things we need to get done to keep this person up to date on their screening tests. So there's tons of different screenings. I encourage you strongly to talk to your doctor about what you may be eligible for or due for. I'm going to go through and just tell you some very common ones that most people would be, getting. It does depend on your risk factors. For instance, there's, at least at Capitol Health, we have a program for screening for pancreatic cancer. There's not a ton of, we don't screen every single person for pancreatic cancer specifically. But if someone tells me I've had 3 family members with pancreatic cancer, then I want that person to be screened. So that person is at higher risk because of that family history. So that's why there's a lot of, kind of details and nuance that goes into figuring out what a person might need. These ones that I included here are for most people who are at just average risk. Just, nothing big runs in the family, you feel fine. What do you need to get done? So blood pressure, I'm going to talk a little bit more about blood pressure just because it's so important, but every single visit you get screened for blood pressure. I think most people are aware of that. Like, you go to the hospital, you go to urgent care, you go to your doctor, you're going to get a blood pressure check. And that's because it's so important and has such long-term importance for health. So every single person, not very young kids, I'm talking about adults because I'm an adult doctor, but all doctors' visits, you're going to get your blood pressure checked. And that is screening for high blood pressure. My patients tell me I feel fine. I still want to know what their blood pressure is. Similar to diabetes screening. Diabetes is so common. I think probably everyone here knows someone who has diabetes, who may have complications of diabetes. Diabetes, can be controlled and treated. If it's not, increases people's risk of heart attack, increases their risk of stroke, can lead to infections, amputations where they lose a leg or a limb. It can have really serious long-term effects. Kidney disease, people can end up on dialysis because of it. So we try to manage diabetes aggressively up front, and like I said, even if you feel fine, we try to identify it early. There's different ways of doing that. The one I prefer, and I think most doctors will use, is what we call the hemoglobin A1C. You'll hear people talk about their A1C. It's just a blood test, and it actually shows, it's one number, a percent, and it actually it's an estimate of the past 3 to 4 months of what your blood sugar has been. So let's say you forget you're supposed to be fasting for your blood work, and you go to the lab to get your blood drawn, and you had just had a soda. The A1C is not going to be affected by that one high blood pressure that's going on right now. It's looking at an average over about 3 to 4 months. So that one number can tell us, is your blood sugar normal? Do you have pre-diabetes and you're at risk of getting diabetes? Or do you actually have diabetes? And if you do have diabetes, is it at an okay level where we feel like your sugars are good? Or is it very high and we really need to be more aggressive with getting your sugars down? So, again, I think we commonly check people. We commonly check it regularly to make sure that it's okay, because we don't want to miss someone with diabetes. Another really important screening test is colon cancer screening. I think this is another one. Most people have heard stories about someone, they either have gotten a colonoscopy themselves or they know someone who's gotten a colonoscopy. That colonoscopy is the procedure where they put you to sleep. You're going to go in, they put you to sleep. And the gastroenterology doctors actually put a camera up your butt. That's what happens. And they look at your whole colon, which is your large intestine. And they can identify if there's polyps, which are small growths, and sometimes they're precancerous. They can remove the polyps, they can take biopsies, and they actually look at your colon health. So they examine your large intestine, essentially. You do have to do a preparation the night before, where you drink a lot of gross stuff that makes you basically clean out your whole system so that they can actually see. Because if they go in there and there's poop in there, they can't see anything. So you have to, drink this gross stuff, you have diarrhea, then you go in and they put you under. So a lot of people are very scared about it, but it's a very common procedure. You're asleep during it. And it's really, really important to do it. We recommend starting at age 45. It used to be age 50, but more people were being diagnosed with colon cancer younger. So we actually dropped that age down to 45. So that's not that old. And if you have not gotten a colonoscopy, or if you really don't want a colonoscopy, you can do a test where you test your poop at home and you put it in a box and you send it in. It's not, colonoscopy is the gold standard because they can actually see your colon, but there are other options. But if you have not done some sort of screening test for colon cancer by age 45, you should definitely talk to your doctor and you should do it. Usually the interval between how often you have to do it depends on a lot of different things. Colonoscopy tends to be about every 5 to 10 years. Again, depends on what they see in your risk factors. But that's one where I have a lot of patients who I'm always nagging them about it, because I'm like, you got to get that done. We got to know that everything's okay and you don't have any, early signs of cancer when it can be caught. You don't want to catch that later when it's more severe and has spread further. Obviously, another super important one that I think a lot of people are aware of is breast cancer screening. So that's for women. Sometimes men do need breast cancer screening. It depends on the situation, but for the vast majority, it's women starting at age 40. And there's some different guidelines, but I generally do, starting at age 40, every single year, a mammogram. So they check and they make sure that there's no signs of breast cancer. I'll skip ahead. Cervical cancer screening, or a pap smear. That's where, some primary care doctors will do it, or gynecologists will do it. I do pap smears for my patients. And that's for women starting at age 21 to check for cervical cancer screening. There's some blood tests we do, like I check everyone for hepatitis C one time because you may not know you have it. Vast majority of people are negative, but we may catch a couple people who have it and be able to prevent problems and maybe even save their life. So I usually throw that in with blood work if you're going to the lab. Another one I put over here, some that people don't always know about, such as lung cancer screening. So when I talk to my patients at their yearly exam, and regularly we check in about smoking. I didn't include one specific slide about this, but obviously abstaining from cigarettes, smoking, vaping, cigars, pipes, and that is a huge thing you can do for preventative care. There's a lot of complications, a lot of lung disease happens, a lot of lung cancer happens because of smoking. And basically it's very important to quit. And there's medicines and things that can help. So, I think most doctors regularly talk about it, and you shouldn't feel judged. You shouldn't feel like it's, your fault or anything. You should just feel supported in that quitting is important for your health, and you have things you can do and people who can help you because it's very, very important. But let's say you smoked for many, many years. You quit and you're doing great, but you're at higher risk of lung cancer because of that smoking history. So certain patients in a certain age group with, if you smoked for 1 year, you're probably not at a super high risk. If you smoked for 50 years, you're at a very high risk. So your doctor will figure out, are you eligible for lung cancer screening? And you actually go and you get a CT scan, which is where they put you in that big donut machine and it makes a loud whirring sound and it checks images of your chest. And they look and they see, do you have any signs of lung cancer early on? So, if you're someone who's smoked a lot and you haven't seen your doctor in a while, it might be something important to talk to them. Like, am I eligible for that? Would that be something I need to do? Same with, there's even screening for something called abdominal aortic aneurysm that a lot of people don't know about. Your aorta is your really big blood vessel that goes down the middle of your body. It comes right out of your heart. It's huge. It supplies your entire body with blood, and all your blood vessels branch off of your aorta. And sometimes people it gets enlarged, it gets widened, and it can actually, in rare cases, rupture, which that's pretty much all the blood in your body. That will kill you. So there's certain patients we screen for that enlargement of the aorta. If you're a male between 65 and 75 and you had, not if you ever smoked, like had one cigarette, but if say you smoked for a year, we would get an ultrasound and just make sure your aorta looks okay. Again, you may have zero symptoms. You may feel completely fine. We still check you. Prostate cancer screening is something I always recommend talking to your doctor about. It's a little bit not controversial, but there's some different guidelines. Older doctors tend to still do like prostate exams, rectal exams at the annual physical. There's actually, us younger doctors don't really do that anymore. There's not a lot of evidence to support it being a really helpful test. I use the prostate blood work, like where you get a lab done and I look at your prostate levels in the blood. And, I think most people like to know they're negative for HIV, test a lot of people for that just to make sure it's screening, even if they feel fine. And then, like I said, there's other ones too that you may qualify for. And that's your doctor's job to go through and figure out what screenings does this person need to keep them healthy and help prevent problems down the road and prevent something from getting worse before we catch it. So that's a huge part of primary care and a huge part of what, your annual physical is. And sometimes, if you're young and you're healthy and you don't have high risk, you might not need a lot of stuff. You go to your doctor, they might say, yeah, get some blood work and you're fine. And that's okay. They're going to look through that checklist and see, like, what do you need to do? And they're going to stay on top of it. Okay, I did want to obviously talk about blood pressure because I think that's, such a huge part of primary care. Just like diabetes, I'm sure a lot of you either have high blood pressure, know someone who does, are very aware of it. Most people who have high blood pressure feel fine. Your body adjusts even to higher blood pressure. That doesn't mean it's a good thing that it adjusts. People tell me all the time, this is just my blood pressure, it runs high. With blood, there are certain things I'm like, okay, that's how you are, not with blood pressure. Blood pressure should be maintained at a normal level. And why does it matter? Because over time, the blood pressure is essentially pressure that your heart has to work against to get blood out. So if you look here on the left of my slide at the kind of cartoon that you see the typical heart, the blue is the right side of the heart where blood comes in, and the red is the left side of the heart where blood comes out. And you'll see at the bottom that sort of thicker muscular part is called the left ventricle. The left ventricle is what squeezes with every beat of your heart. It's a really strong, amazing muscle, and it squeezes to squeeze the blood out to your body. If your blood pressure is high, that left ventricle is constantly working against a high pressure. And you can see in the second picture, the second cartoon, that wall of that muscle gets thickened because it just has to work so hard against that blood pressure for sometimes years and years. Now, on the right side, there's a picture of, pathology picture of an actual heart. You have to kind of, the picture on the right is cut through the heart at a different angle. But that sort of thinner open part that you can see on the left of the picture is the right side. And that thick part where there's barely any space in the middle, that's a left ventricle that has been working against a high blood pressure for years. There's no space in there for blood to come in and fill up. So your heart, eventually, high blood pressure can lead to heart failure because your heart can't really pump well anymore. It can lead to stroke. Blood pressure is like the top risk factor for stroke if it's high for a long time. It can cause, kidney damage. It can also lead to dialysis. So blood pressure seems like such an, people are like, it's just my blood pressure, I feel fine. But it is such an important part, and that's why we always screen everyone. That's why your doctor's probably always talking about it, making sure it's good. Many people are on medicine for high blood pressure, and there are tons of different medicines that can be used. And sometimes people need multiple medicines, but I did include here, what is a normal blood pressure. So usually less than 120/80, or, the yellow one is okay too. I'm usually okay with green or yellow there. If you're in that orange range where your blood pressure is, say, 135/85, it's getting a little bit on the higher side. And certainly if it's over 140 for the top number and over 90 for the bottom number, you need to, check it at home. You need to watch it very closely. You may need a medicine. If it's very, very, very high, like over 180 for the top number and 120 for the bottom number, you definitely need to be seen. You need to talk to your doctor. Some cases you need to go to the hospital, but it's very, it kind of depends on the situation. You definitely need to talk to someone. And then the last thing I wanted to talk about was vaccinations. That's another huge part of preventative care, like preventing problems later. And also a huge part of what primary doctors, internists, family med doctors do at each annual visit is check what vaccines does this person need? How can we help keep them healthy? So I included kind of some very common ones. Again, these are just like for a usual person living their life. If you're traveling somewhere, you may need different vaccines, or you've been exposed to something, you may need a different one. I did want to talk for a minute about the shingles shot. I always strongly recommend that all my patients over 50 years old get the shingles shot. The picture on the right is the shingles rash. Shingles, it's a virus. If you ever had chicken pox, you have the virus in your body, and a lot of times it just stays there. It's what we call dormant, it's just kind of sleeping. It's there. You get stressed, you get older, something happens. That virus can come out and it travels along your nerves and it causes that rash. People get it on their legs, on their bellies, in their eyes, in their ears, on their faces. It's in your nerves, so it's extremely painful. And it can cause lasting nerve pain. Even after it's treated, people a lot of times have pain that continues for a while after. So I always recommend people, whether or not they had chicken pox, they're over 50, they should get the shingles vaccine. It's 2 vaccines given 2 to 6 months apart. And then you're done. You don't have to do it every year. It's not like, you get the series one time. Getting the vaccine decreases your chance of getting shingles by about 50%. And you could still get it even if you're vaccinated, but you're more likely to have a more mild case and not have long-term effects. So that's I tell all my patients that at the annual physical. That's my little spiel about shingles shots. Strongly recommend it. You can get it, at your doctor. You can get it at CVS, at Walgreens. The pharmacies all do it. Usually the one we give is called Shingrix, and that's the shingles vaccine. You don't want that rash. Pneumonia is a little more complicated, but we do, so I'm not going to go into detail, but we do recommend pneumonia vaccine for adults, usually over 65, or if you're at high risk. There's the tetanus booster. If you've ever stepped on a nail or gotten a cut in your, doing something in your yard or something like that, you went to urgent care, your doctor, you probably got a tetanus shot. So it's actually 3 things in one. It's tetanus, diphtheria, and pertussis. And we generally recommend you stay on top of getting a booster shot just to give yourself a boost every 10 years. There's also Gardasil, which is the HPV shot that prevents against a sexually transmitted virus that can cause different kinds of cancer. And it used to be only up to age 26, but you can actually get it up to age 45 now. So I do recommend that one for a lot of people. Flu shot every year. This year was a really bad year for the flu. I saw so much flu this year, and a lot of people just feeling terrible. You can still get it even if you get the shot, but those people tend to have a much more mild case. The ones who were really sick this year that I noticed, they were the ones who forgot to get their flu shot. So, and then there's still COVID shots out. We'll see what happens. There's that, guidance for that may be changing, but right now in my office, we still give people a COVID booster as well. Okay, so to kind of summarize everything we talked about, we're talking about how to prevent problems down the road and what to do for primary care. So I said, these are the takeaways I want you to take. As much as you can, eat a healthy diet, avoid soda, juice, cut down on the carbs, exercise regularly, 150 minutes a week. That's the goal. If you see your doctor, at least if you're healthy and you have no problems, it doesn't necessarily have to be every year on the year, but regularly see them, check in, just make sure you're all up to date with everything. If you don't have a primary doctor, I know sometimes it's hard to find them and there are wait lists, and that's an unfortunate reality, but just work on trying to find one. Ask your friends who they see who's taking new patients, and at least try to get one when you're feeling healthy and you don't need it right away, but then you'll be established with someone. Obviously, we talked about quitting smoking. If you're a smoker, that's very important. And get your screening tests done. If your doctor orders a mammogram, it doesn't have to be done, the day after you see your doctor. You can do it when you have time, but try not to let it go, years. You want to get things done so that you're up to date and you're all covered for preventative care. The other thing I put in here is also learn your family history. Talk to your family if you can, if you know them, if they know their history, because that also affects what screening you may be eligible for or what you need to do for your own health too. So just knowing that and having a good list of that is really helpful as well. And then, get your flu shot every year, stay up to date with vaccines, get the shingles shot. And those are all important things as well. And I think that's all I got for you today. I'll check the chat if there are questions. Let me see. Hold on, let me see. Okay, so the first question I see is, what are the most important screenings for someone ages 55 and above, both gender? So, I mean, it's hard to say it's hard to define what's the most important. The ones I kind of feel are absolutely essential for someone age 55 and above would be colon cancer screening. So colonoscopy or the stool test, checking, for colon cancer. For females, staying up to date on mammogram, because I think a lot of people know breast cancer does kill a lot of people, and a lot of times can be prevented if it's caught early. I think the ones I mentioned, like blood pressure, diabetes, those are probably the ones I would say are, if someone said I'm only getting 2 things or something, I would say those are the ones I want you to get. But again, like if someone qualifies for lung cancer screening, I also want them to get that too. Okay. Someone said, can the doctor elaborate more on prostate? I thought she said only blood work results is not enough. Should a patient do a different kind of test? So, okay. So prostate screening is complicated. There's not a super strong recommendation from one, one governing body that's done research about prostate screening. Like colonoscopy is very clear, like starting at age 45, you should get colon cancer screening. Prostate, the recommendations are actually discussed with your doctor and talk to your doctor about it. The issue with prostate cancer screening is sometimes we have a lot of false positives. So we get blood work on people. It comes back high for the prostate number. And then we have to do something about that. It is the risk of all screening that you may have false positives. So, it happens fairly often that we have a high prostate number when we screen. We send someone to a urologist. They may get an MRI. They may even get a prostate biopsy. And after all that, it's not cancer. So that can be a tricky thing that puts someone through something that's very stressful and hard, and they have to actually do that and follow up on it. And then it turns out it's not cancer. Right. So that's something that has to be sort of balanced with the risk of finding prostate cancer. Prostate cancer tends to be very slow growing and it doesn't usually kill people as much as, say, colon cancer does. So especially if you have a strong family history, I think it's worth getting screened. You can always talk to your doctor about it. You don't necessarily need the rectal exam, the prostate exam by a primary care doctor, but usually the blood work, the prostate specific antigen or PSA is checked in the blood. And I think most doctors will recommend doing that at least yearly just to make sure that it's okay. Prostate specifically is very, there's some nuance, it's more complicated. Do some experienced doctors, older doctors, generational, still follow traditional approach over newer advancements in preventative medicine? Absolutely. Medicine changes. Some things change very fast and some things change very slow. And even when there's a lot of research coming out, it's hard for, if you've been a doctor for 50 years, it's hard to suddenly change everything you've been doing for those 50 years just based on new research. So I will give you an example. There's not a recommendation for doing an EKG, which, if you don't know, they put little electrodes on your chest, like little sticky things, and they connect you to a monitor and they check the electrical activity in your heart. An EKG is about 10 seconds of data. If you're not having pain in your chest or trouble breathing or palpitations, like feeling your heart beating really fast, There's not any evidence for doing EKG as a screening test. People can have a normal EKG and still have a heart attack, a couple weeks later. People can have an abnormal EKG and have a totally fine heart. So it's not a good I don't recommend that. I don't get an EKG on every patient at their annual physical. There are many older doctors who are more old school who will do that and still get it every year, and they'll say it's important. And I don't think it's wrong to do it. It's not harmful to get an EKG. There's not a lot of risks, but sometimes these things change slowly, and you may have one doctor who does one thing and one doctor who does things a little bit differently. I'm a younger doctor who's more fairly recently trained, so what I do may be a little bit different than someone who's been practicing for 60 years.
Okay, Dr. Zucker, I have like 3 questions.
Okay.
Yes. First one is, I don't know how non-smokers get lung cancer. So how is that possible for
non-smokers?
Yes.
So there's different types of lung cancer. And I'm not an oncologist, so I'm going to give you the broad strokes, but there are certain types that are more strongly related to a smoking history. But then there are certain other types that, anyone can get any cancer at any time. A lot of it is genetics too. So, there are some that are more genetically linked. Someone may have never smoked a cigarette and they still get, a certain type of lung cancer. They may be less likely of getting the type that's related to smoking. They may get a different kind. Also, sometimes people have exposures like work exposures, asbestos, things like that, silica, like other things that maybe they weren't using protective, for whatever reason, like protective face masks and stuff at work when there were chemicals, and those can cause lung cancers. Like a lot of people have heard of mesothelioma, which is related to asbestos exposure. It's a super, super rare cancer, but that's a reason someone might get a form of lung cancer that's not smoking. But sometimes things do just happen too, but it's much, much rarer in non-smokers. And that's why we don't screen non-smokers.
Okay. And my second one is, you said the people with high blood pressure should do more tests. What about the people with low blood pressure? Is there any risk for them or?
So low blood pressure, I guess, are you talking about like very, very low blood pressure? Because that's usually a sign of something bad going on. But if it's just like 100/70 and you feel fine and that's how it always is, that's totally fine. Oh. That we are good with. Okay. We're like, okay, your blood pressure's perfect. Like it doesn't have to be exactly 120/80. Okay. The time it's bad. So when people get infections, like a severe infection like sepsis, their blood pressure may be dangerously low. And that is a problem. So if you're sick, if you feel very dizzy or lightheaded and your blood pressure is low, if you're on blood pressure medication and you feel bad, and you check your blood pressure and it's too low, your medication might need to be adjusted. But I have plenty of patients who are like young, healthy people without high blood pressure. They're not on meds and their blood pressure is like 90/70. And we don't do anything about that. It's totally fine.
My next one is the abdominal aortic aneurysm. I never heard of that before. So can you elaborate on that, please?
Yeah, I know that's one. It's sometimes, to be honest, that screening is sometimes a little bit harder to get from a practical standpoint because insurance isn't always they're kind of annoying about covering it. But that is a condition that is, so that what I talked about with the aorta being big, that enlargement of the aorta, it's pretty rare, and it's much, much more common in men who have smoked. So that's who we screen. older men who have a history of smoking. We don't recommend routinely screening women for it. However, I absolutely check for it. Like if someone tells me they have some sort of, symptom or they're noticing something and I am worried, could that be possibly an abdominal aortic aneurysm? Then I will get an ultrasound. That's different. But for screening, we just recommend men who have ever smoked ages 65 to 75, I think it is.
Thank you. So do any other person have any question? You can raise your hand up or you can put it in the chat.
I think there were a couple more in the chat. Let me see.
Oh, okay. Yes. Can you don't elaborate on prostrate? Okay.
Someone said, what do you recommend for arthritis, knee pain? That's less preventative care, more like treatment, but arthritis is really common. And, generally the first steps for arthritis are physical therapy, medications, like non-steroidal anti-inflammatories, like the kind of medicine like ibuprofen, but sometimes you need a joint replacement for arthritis. So that's another one where you kind of have to see where things are at and talk to your doctor about it.
Okay, there's one that says, please, what is your take on smart wristwatch that automatically measure blood pressure every 10 minutes for convenience and compliance, even when it's been calibrated and compared with cuff blood pressure measurement?
Yeah, that's a good question. So I am very supportive of people checking their blood pressure at home. A lot of people come to the office and they get their blood pressure checked and it's high. And they tell me, but I check it all the time at home and it's fine. And they're stressed because they're meeting, they think I'm going to be scary, even though you can tell I'm not scary. But, you go to the doctor, it's a little bit stressful. So your blood pressure might be higher. So I really like knowing what people's blood pressure is at home, generally day to day when they're living their life. So there's a lot of different ways you can check at home. Mostly, there's two main ways of checking blood pressure. One of them is what we call an automatic cuff. That's usually what you buy at Walgreens, on Amazon, and you put it on, you press a button, and it just squeezes, gives you a number. When you go to the doctor's office, they may check what we call a manual. Where this is what I do for my patients. I put in my stethoscope and I listen and I hear the sounds while I'm checking the blood pressure. That tends to be a better measurement, but the automatic ones are fine, and a lot of them are very accurate. I don't think you need to check your blood pressure every 10 minutes. Probably the only time in my life I would say it needs to be checked every 10 minutes for blood pressure is if someone is like very acutely sick in the hospital. That's generally, I tell people, check it once a day, check it twice a day. And that's if we're making changes. If you're stable, your blood pressure's been good, you check it a couple times a week, just make sure it's been okay. That's totally fine. You don't need to check all the time. It's very important, but blood pressure is a long-term problem. You don't need to, checking more doesn't necessarily mean better. Sometimes the wrist measurements, I've had people who have like finger blood pressure check, cuffs that go on their finger. It kind of just depends. Sometimes they're very accurate, sometimes they're off. But like you said, if you bring it to your doctor, like you bring your home cuff into your doctor's appointment, they can check what did they get in the office and what is your home one and kind of compare. And if they're significantly off, then you have to take your home one with a grain of salt. It may not be accurate. But you can see, like, if it's pretty close, then you can probably trust those numbers. And you always want to take your blood pressure. You don't want to have a full bladder. You want to be, seated. You don't want your legs crossed. You want your arm that you're checking to be relaxed, no tight clothing, at heart height. That's going to give you the most accurate number. So sitting feet flat on the floor with your arm on a table right in front of you and you check is the best way to do it.
Any other question?
Oh, the next one is a really good question. What are the cultural biases that work against medical care for people of color, as this is the major population in the Zoom presentation? Absolutely. I think we know there's a huge disparity for people of color in healthcare. I think there's so many different reasons for that. A lot of it is, you know, past experiences, not being taken seriously. Like there's so many different things that go into that. And you should find a doctor who you trust, who you feel like listens to you. You know, if you're a person of color and you find a doctor who looks like you, that's also can be really, really helpful. And there's also conditions that are more common in people of color, and that might increase your risk, and you should be screened appropriately. Like you should be, you know, you shouldn't be treated any differently, but you should be treated well and have like good medical care no matter what. So, you know, I think that's a topic that could be a whole thing, but it's absolutely, there are biases and, you know, it's an ongoing issue. You know, even just there's been a big movement, like a lot of times rashes look different on darker skin colors, and a lot of medical textbooks are only on lighter skin colors, and that's a huge problem for people who are training. You need to see how things look on all skin colors, right? So like there are movements to try to make those things better, but it's certainly not perfect, and there's a long way to go too. The next one is, are there effective remedies for high blood pressure beyond lifetime medication? There's not any like I don't know of any herbal supplements or anything like that that's shown to be helpful. Medications are usually the thing that helps the most, but absolutely exercise, DASH diet, losing weight, those things, you know, obviously losing weight is also could be its own discussion and topic, and it's very difficult, but those are things that can help too. And I usually tell people when I'm starting them on a blood pressure medication, it doesn't necessarily have to be the rest of your life. Like things can change and you might not need it at some point, and that's totally fine. We can stop it. But, you know, if your blood pressure is high, it needs to be managed. But there's no like supplements, you know, like herbal things, nothing that I know of that's really going to be effective. The next one is about clinical evidence that ejaculating more often can reduce risk of BPH and prostate cancer. I actually don't know. That's probably a question for a urologist. Not that I've read about or heard of, but certainly like a urologist is a specialist in prostate and sort of men's health. So I think I already touched on the important vaccinations needed for, yeah, we did that one. Is there a new method of mammogram besides the traditional way? They, again, I don't know the radiology details of this, and there's a lot of, you know, detail that goes into this, but I think there used to just be a 2-dimensional mammogram, and now they have more of like a 3D one. I don't think the mammogram's really done any differently than it used to be, but it's like how the images are collected and how they look at them, and it can give more information. And I didn't go into great detail, but some women need further screening, like your doctor may recommend mammogram, your doctor may recommend mammogram and ultrasound, you may need an MRI of your breast. So there's different, like nuances depending on, you know, like the mammogram can be a little bit complicated too. So depends if you have dense breasts or not. There's a lot to discuss with your doctor.
I have one question, Dr. Zucker.
Yeah.
Is there any like prevention for cervical cancer?
Prevention for cervical cancer?
Yes.
So a huge risk factor for cervical cancer. So we're talking about cancer of the cervix, which is for women or those who are born with, vaginas. It's the uterus has the bottom part, which is the cervix. That is a fairly common cancer. That's why we recommend screening so aggressively with pap smears. So the biggest risk factor is having HPV or human papillomavirus. That's why we recommend earlier on getting the Gardasil or HPV vaccine, because it actually like that vaccine came out, I want to say in like somewhere around 2006 or so, and actually cervical cancer numbers have significantly dropped since then because that virus stays in the cervix and causes abnormal cells, and that leads to cervical cancer. However, you can get cervical cancer even if you never had HPV. So that's why we do recommend screening regularly for women pretty much their whole lifetime, starting at age 21 and then all the way up to generally age 65 or so. But there's not, that's the biggest risk factor we know of. So usually I'm talking about Gardasil and the HPV vaccine.
Yeah, I know the kids get the HPV immunization that they get. So do adults get it too?
So the problem is when it first came out, it was only approved up to age 26, and now it's approved only up to age 45. So if you're above 45, you can't get it right now. Unfortunately, it's just not approved. Okay. HPV is sexually transmitted. So what I tell people is if you're in a monogamous relationship, you only have sexual intercourse with one person and neither of you have HPV, you're not going to get HPV. They usually at pap smears for women over 30, they usually check for HPV too. They do what we call co-testing, and they look to see if there's abnormal cancer cells. And then they also will, like, as part of that test, look for HPV virus. And then if you have HPV virus, there's not really a treatment for it, but they'll monitor you more closely and make sure things aren't progressing. Does that make sense?
Yes, thank you.
There was another question. Do yearly mammograms expose women to radiation? What are alternatives? So I think mammograms have a small amount of radiation. Most imaging, it's less than like a CT scan. Generally we feel the small amount of radiation you get from a mammogram is far outweighed by the benefits of being screened. If it's something that's a huge issue, or there's like a reason you can't get it or whatever is going on, ultrasound and MRI are not radiation. So, it's something that like you could discuss with your doctor. Sometimes insurance might be a pain about that, to be honest, but ultrasound is just sound waves. There's no radiation, and MRI is magnetic. There's no radiation.
Doctor, I have a question for you.
Yeah.
Yeah, I just want to inquire information regarding people going through mental health issue. Is there any screening that people can go through on how will the doctor detect about somebody going through mental health? I think I would say some people are going through in a different forms, and they irradiate and go beyond what without detecting that somebody is going through that. Is there any blood work? Is there any text? Is there anything that people can go through and say, look, yeah, I want to check, or the doctor can look into it?
That's a really good question. And unfortunately, there's certainly not like imaging or a blood test that can really help. There's nothing that we can really detect with that. But so I think most places will do like a depression screening. We have a standardized depression screening test that we'll do where we just ask you 2 questions. And if they're positive, we'll ask you more questions, and they're like common signs of depression. And so like at my office, when you come in and you get your vital signs and the nurse rooms you, and then the nurse will ask those questions and then tell me if they're positive. And then that opens a door to a discussion about mental health. Mental health is very complicated. There's a lot to it. That's just for depression. And sometimes it's just like opens a conversation, and then we figure out what's going on. Like, you may be positive on the depression screening because you're dealing with chronic pain. You're not actually depressed. There's, other things going on, but it helps us kind of identify people who may not feel comfortable talking about it or might not want to bring it up. There's many different mental health conditions besides depression. There's not good screening. I think honestly, the most important thing is having a doctor you feel like you can talk to and trust. A lot of times people need to talk to a therapist or need some support or need medicines or whatever it is. And I think that that's a place where people can easily fall through the cracks, especially if it's hard to talk about, which it usually is. And, I try to kind of like get a little more detail from my patients, or if they seem very down or they kind of bring up something, like I try to get more information. But, we see a lot of patients in a day and we don't have endless time with each one, unfortunately. So, sometimes that means I have people come back more often, or I check in a little bit more, try to build a trust with them so they feel like they can talk to me about it and we can have ongoing discussions. But there's not like a test we can do, unfortunately.
Yeah, the only reason why I'm asking the only reason I'm asking the question is this. I remember back then, this is during the 9/11 issue that, a lot of people lost their job and issue happens, and then maybe later visit your doctors, and then they could see the signs. Some people will go to their doctor and have a good rapport with their doctors and stuff like that. I'm just saying this is what happened back in then. So I was there, and then the doctor asking me a question. I said, "Oh, you are not, this is not you. What is going on?" You realize that this is 9/11 issue. You lost your job. You are looking for something. And one of a sudden, I don't know what he did and something like that. They gave me medication for depression. So I didn't know what it is, and I look at it. So I Google. That time you don't Google. You just go on the line and say, "What is this?" So what I did, I didn't take the medication, but they didn't take it out of my list until probably maybe 5 years later or 4 years later. Like they count me like I may depress somebody or whatever. So until I realized that list of medication, they telling me this thing, this. I said, "What is this one?" They told me depression. I said, I'm not depressed. It was during the period of time. So before, sometimes you can go there and complain about one situation, but to follow up and telling you like, I'm normal, then they give you that medication. I think giving you that medication become a problem. So it will be like on a lifetime medication, like a blood pressure, and that is a problem. So that's why I'm asking, is there any test or somebody can go through before they can start giving medication? That's my own experience. Thank you.
And I think, like I was saying, it's important to have a doctor who will take into account everything that's going on, right? Like, is this a situation? Is this related to 9/11? Is there something else? And we'll take that into account. But I'll be honest, not every doctor is going to do that, So just it's okay if you really don't like your doctor to try to find a different doctor too. There was also a question about fruit in the chat. Dried fruit, and then what fruits have the highest sugar. So generally berries tend to have lower sugar. So like strawberries, raspberries, blueberries, I tell my patients with diabetes, like those are good fruits to eat. Berries, orange, apple, banana, those tend to be higher. Tropical fruits like pineapple tend to be higher in sugar, and can, spike your sugar more. Dried fruit is another thing that's okay in moderation, but the problem with dried fruit is you end up eating way more than you would if it was like fresh. So even if there's no sugar added, next time you're eating dried fruit, kind of see like, would I eat this much of an apple? So if you're just eating a couple pieces, that's totally fine and, still has fiber. But a lot of times people end up eating a lot more and then they're getting much more sugar through the dried fruit. It's a little more concentrated. So again, if you don't have diabetes, totally okay, moderation. If you're someone who's watching your sugar, it might be something you need to watch out for. think we caught up in the chat.
There's one. Yeah. Yeah. One. What are the foods with the highest sugar? You know, some foods have so much sugar that you just have to avoid them.
I would say there's one that everyone has to avoid. Just like I said, like pineapple has a lot. Apple. Usually, like the berries are a good choice because those are not as high in sugar. But again, and that's a good point about grapefruit. Grapefruit can interact with medications. Depends on the medicine, so check with your doctor. Usually the issue is if you're drinking a pretty large amounts of, like if you're eating like multiple grapefruits a day or having a lot of grapefruit juice, you know, let's say you eat half a grapefruit, whole grapefruit every day, it's usually not going to be a problem with your medications, but there's some that do matter. So it's a good question for your doctor just based on like what you're taking.
Okay. So thank you, Dr. Zucker. Yeah, could you provide contact number in case a member would like to schedule a visit to your clinic?
Yeah, sure. So I'm at the Capitol Health primary care Mountain View location. And our office number is 609-656-8844. So we have, Capitol Health has a lot of different primary care locations, like all in New Jersey, some in Pennsylvania. There's a lot of different primary care doctors. I am taking new patients. I think most of us are taking new patients. Sometimes it's a longer wait depending. But there's a couple doctors in my office, and then there's lots of other Capitol Health doctors too. So that's our Mountain View office, but there's other ones too that may be closer to you or you know, nearby. Anything else? Any other questions?
Well, if there's no more question, Honorable Okoya, can you give?
I'm asking about blessings, everybody. Hello, blessings.
Oh, are you asking about nerve damage?
Yes.
There's a lot of different things. That's a complicated question. To give a quick answer, the most common things that cause nerve damage is the most common thing we see is diabetes. Low vitamin B12 can cause it. Certain medications like if you've had certain chemotherapies in the past, that can cause nerve damage. Sometimes it's a structural issue, like if a nerve is pinched coming out of your spine because you have a bulging disc, that can cause it. Those are like the top, I mean, you know, thyroid issue. There's other things, but those are like the top reasons. And solution is usually pretty hard. Like a lot of times we do medications for nerve damage, but sometimes the damage is done. Like, you know, if you have diabetes nerve damage, it's hard to reverse that. Usually we just try to prevent it from getting worse and we treat the symptoms. Sometimes it's what we call idiopathic and you have nerve pain or nerve damage and it's not a clear cause. And that's also it's very hard to treat. You know, you still need a good workup. Like you need to, you know, a lot of times people need to see a neurologist and have nerve testing and, you know, figure out, is there something we're missing? And if there's nothing identified, a lot of times we just try to treat the symptoms and let you live your life.
Honorable Arowolo, can you give vote of thanks? Like, thank you, Dr. Zucker.
Thank you so much. Thanks for having me.
So your number is 609-656-8884.
8844. That's our office number for the Mountain View location. That's where I am. Okay, that's our specific office number.
So is that's correct?
Another question.
Oh, yeah.
Can you read it?
Let me see.
What is the actual cause of cramping? My 60-year-old aunt goes through it all the time.
Like, are you talking about muscle cramping?
Yes.
Again, it's something there can be a lot of different causes. Sometimes it's what we call restless leg syndrome. Sometimes it's electrolyte problems. Again, I always like to check everyone's thyroid, make sure that's not, affecting things. I will say I have a fair amount of patients who have pretty severe muscle cramping, and we've never identified a cause. Some of them have had it their whole life, and they've been tested for everything, and they just get cramps. Can be hard to treat. Sometimes we'll try like a magnesium supplement and do different things, but that's a tough one. And I definitely, it's actually fairly common. I see it pretty regularly that people have very bad cramping, like that kind of Charlie horse feeling in their legs, or they do get restless legs. It's a tough one.
So what do you do when you have the cramp? I just bang my leg on the floor.
Yeah. I mean, I always do check people's labs, their electrolytes, make sure we're not missing something. Iron deficiency can cause, leg symptoms. So I always check that. But if all that comes back normal and everything looks good, then, sometimes I recommend they make like lotions for leg cramping, trying some magnesium. Sometimes vitamin K2, which you can get over the counter, can help with cramping. Drinking more water. It's a tough one. It is, and sometimes they do just happen.
Oh, the vitamin K2. What is the mg?
I'd have to look. I don't know off the top of my head. Actually, I'd have to look up the dose. But they make supplements over the counter. You can get like vitamin D with K2. A lot of people take that, and it's just like the usual.
What about the vitamin D? The vitamin D is 2,000 good or 5,000?
Either one. I generally recommend. I usually check people's vitamin D I check people because sometimes it's very, very low and they need a high dose, which is prescription only. But 2,000 or 5,000 a day is totally fine. Either one. It also depends how low your levels are. If they're pretty normal, I'd say 2,000 is good. If they're on the lower side, 5,000.
There's a question in the chat that says, what is your take on the medication like Trulicity?
Like the GLP-1s and like Trulicity, Ozempic. That's another thing that could be an entire discussion in and of itself. I think that they have a lot of benefits and they can really help a lot of people. Certainly for diabetes, they're very effective, and I use them a lot for diabetes. And I have a lot of people who are on them for weight loss and prescribe them pretty regularly too. That's like, I have a whole visit where I just talk about that with patients if they want to talk about it. There's a lot there, but I generally am supportive, and especially for people who can have issues like sleep apnea or high blood pressure or pre-diabetes or diabetes, like they can be helpful for losing weight and help make those issues better. So I generally am pretty supportive of them, but it does depend on the person and the situation.
Okay. Thank you, Dr. Zucker, for your insight on the preventive medicine and screening. So, Honorable Arowolo, can you give the thanks? Thank you all for coming.
Thank you, everyone. Have a great Saturday.
Blessings.
Thank you.
Can you all hear me?
Yes.
I'm at work, but
Yes, we can hear you.
I'm at work, but I'll quickly give the short votes of thanks. Blessings, everybody. On behalf of our ECI and ECP, I would like to express our sincere thanks to the special doctor that we invited today for sharing our expertise. And I would like to thank the organizer for all their tireless efforts, and all attendees for making this conference a success. Your presence and contributions have greatly enriched our learning and professional development. Thank you all. God bless you.
Thank you all for coming.
Thank you.
Thank you, Dr. Zucker.
Thank you so much.
Thank you.
Thank you, everyone.
Thank you, ma.
Bye-bye. Thank you, Doc.
Thank you.
Thank you, Doc.
Thank you.
Thank you, Doc.
Dr. Agunloye.